mental health is just part of being human. All of us have mental health on a spectrum, and globally 1 in 4 of us will experience a mental health problem. So it's very, very common experience. But sadly, in most cultures and contexts around the world, it's still something where you will face prejudice, exclusion and discrimination just because you're struggling with something in your mind. Whereas what we want is for the same respect and support that you would have if you had a physical health problem. And that's what we call stigma and discrimination, and why these campaigns that are evidenced in all global regions, what works to shift public attitudes, but more importantly, how the public behave towards those of us with mental health problems. But we've got to have more open conversations about mental health. If you can't talk about it, you can't seek help. If everybody judges you, if you can't get a job, you can't stay in education. These are all really serious impacts of stigma.
And what's really exciting is being able to produce quality material that fits with our community, that says something about this community and not other communities. It's an ongoing thing. It's a way to keep involved in this community as well, and to make sure we are promoting mental health for all. We're isolated from everywhere else, and I think that's huge. Again, for people who have families and connections here, that can bring its own strengths and challenges, but also people that are here on their own and people that are here without family, that brings its strengths and challenges as well. So there's a whole range of things I think that can affect people's health and well-being here.
There are daily things that we can do, I guess, checking in with one another, just starting those conversations really, and trying to be a bit more open about our mental health, perhaps in the same way we are about our physical health, so just trying to start those conversations in our community, I think, is really important.